Hi, I'm Charles Gauthier, President and CEO of the Downtown Vancouver Business Improvement Association. We're proud to sponsor the Coping with COVID-19 daily podcast series this month and hope you've enjoyed the great video content produced by Business in Vancouver. I know that my team and I have found this series informative and helpful. Please help support our local businesses during these very challenging times. Whether it's buying a gift card from your favorite retailer or treating yourself to takeout from a local restaurant, your support is so important right now. Thanks, everyone, and stay strong.
You're watching Coping with COVID-19 for Friday, April 24th. My guest today, Todd Litman, founder and executive director of the Victoria Transport Policy Institute. He's just published a new report titled Pandemic Resilient Community Planning, which, as the title suggests, explores how we can plan communities that are resilient to economic, social, and environmental shocks. A very timely report. Todd, hope you're doing well. Thanks so much for coming on the show.
Thank you, Haley.
I think it's maybe worth starting off with a definition. When we talk about resiliency, that might mean different things to different people, but from a planning perspective, what does it mean to have a resilient or pandemic resilient community?
Right, so there's quite a bit of literature on what constitutes resiliency. And usually in the past, it's focused on infrastructure resiliency. So how can you make sure that your electric power won't fail and your water systems will work and you'll be able to withstand storms in your community. So there's quite a bit of thinking about how to build stronger infrastructure and anticipate, for example, if one link in your water system or one roadway fails, how you're going to keep the system operating. So you build in some redundancy, and that's very straightforward. If you're a civil engineer and you're interested in the infrastructure, you have a pretty good way of thinking about resiliency. But of course, disasters and other shocks, other economic and environmental shocks, present other types of risks. And what's really interesting about pandemics is that the threat is not to the infrastructure, the threat is to people. So building stronger bridges or better electrical systems, more redundant utilities does not address pandemic resilience. But having a diversified transportation system, so if, for example, people are no longer using public transportation as much. They want alternatives to driving and taxis and public transportation. Then we need to plan that in. We need we need a more diverse transportation system to deal with concerns about infection risks in public transportation. But what's really interesting is this pandemic experience has raised some other important concerns. A really important one is affordability. So for most people, the pandemic risk is not about getting deathly ill. It's about losing their job, losing their income, and having to live with several months of economic uncertainty. So it's the economic shock that is really the main concern, or it's one of the main concerns. Another issue that's come up very prominently in the pandemic is the concerns about homelessness. So in the past, there certainly was a lot of legitimate concern about homelessness as you could call it a human rights or concerns about disadvantaged people. It's a social equity issue. But the pandemic has also reminded us that there are risks to everybody in the community if some people in your community are unhoused. So the infection risk becomes an additional special concern, or it raises the concern about homelessness and provides an additional reason for communities to make sure that everybody has a house. So those are the issues. That's where we expand the definition of resiliency, of community resiliency, when we're thinking about pandemics compared with other types of disasters or other economic and environmental shocks.
That's really interesting. To that point, I've heard this situation described as an economic crisis tacked on to a health one. And there's obviously been huge economic impact that's resulted from government measures to try and keep us healthy and safe. Is there a way to marry social and health priorities with economic priorities when we're planning for a pandemic?
Absolutely. So a lot of these issues have been major concerns in the past, and the pandemic shocks, the health and social and economic shocks just make them that much more evident. But for example, inaffordability has been a major concern, especially among, let's say, not only is it for the very poorest population, but a lot of working class, people are struggling to afford their housing and transportation costs, even well before this pandemic. That is for many households, it's a chronic problem. And so a lot of my work for the last few years has been looking at how planning can support more affordable housing and transportation options. That's going to become even more important now. Whether you use the term resilience or social equity, or you're concerned about economic development, say you think about in a city like Vancouver or here in Victoria, if a restaurant wants to expand, one of their biggest constraints is finding workers who are willing to live in a high cost of living community like ours. So there are many reasons that communities should be reforming their housing development policies and their transportation policies to support affordability. And that's going to become very evident. It already has become evident. And the longer the recession, the current recession continues, the more important affordable housing and transportation are going to become.
Mm-hmm. Throughout all my life in varying levels of school, we've done earthquake drills. And I've always been told that we're waiting for the big one. It's going to come. So earthquake preparedness is kind of being top of mind. Never have I ever gone through anything like a pandemic drill of that kind. But do you think that going through a pandemic like this will force individuals, households, and communities to rethink how they think about pandemics and how they prepare for these shocks that do happen? We don't know when, but they do happen.
Well, certainly, although I personally think that's the wrong way to approach it. Because as people often joke, or my military friends often joke, that generals are always fighting the last war. That whatever the last disaster that occurred seems to be the one everybody starts preparing for. So over my career, and I've worked on disaster response management on a few projects. A couple decades ago, it was terrorist attacks and concerns about, people were saying, oh, everybody's going to abandon cities because cities are so dangerous, and they'll point to the 9/11 terrorist attacks and then subsequent terrorist attacks in public transit systems and other things like that, and frighten people. And then, of course, there were the problems with hurricanes, Hurricane Katrina and Hurricane Rita, and all the, and other ones, and ice storms, and on the East Coast, and and earthquakes, of course. There are often these disasters. I should mention, disaster response planning is actually quite fun in a morbid way, because just like my grandmother would have said, you want to hope for the best, but prepare for the worst, right? That's good advice for everybody. And so part of disaster management planning is sitting around thinking, what's the worst thing that could possibly happen here? And you look through the history and you look at how many people died, and say the 1906 San Francisco earthquake and the terrible things that happened. Actually, the earthquake didn't kill most people. Most people died in the subsequent fires, and it caused infection, or it caused infectious diseases, and there were riots, and the military came out and shot some people. So if you're involved in disaster management, you have to think, you study all the bad things that have happened and the mistakes people make, and you think about how you would deal with that. So my point is, I think it would be a mistake for communities, for cities and provincial governments or whatever, federal governments, to plan for another pandemic just like this one. The next disaster we face is very likely not going to be just like the last one. So the basic human intelligence is that we learn from the past problems, but the 1906 earthquake in San Francisco, or Hurricane Katrina, or the COVID-19 pandemic, and plan for a repeat of exactly that. We generalize it. We figure out what to prepare for. And that's where I think, and the concept of resilience is saying, we're going to be prepared for whatever unexpected changes, what economists call shocks. Whatever the shock we're going to face, we should be prepared. So, for example, your household wants to be prepared with, a store of food and a fire extinguisher and, some basic household resiliency planning. Great. But also, you want to be thinking, what would happen? How will we deal with it if we have to go, let's say, 3 or 6 or 12 months without much income? Are we prepared for that? Or are we prepared for our car breaking down, or me becoming physically disabled and I can't drive, or I can't walk very well? These are all shocks that your household or your community could face. And so resiliency planning is about thinking these through. What can we do now to prepare for potential shocks? And that's where I think we communities could be doing, households and communities could be doing a lot. And a lot of it is just simple. It's making sure, for example, that you live in a community where you don't need to drive everywhere. That is transformational in this, when you're facing these kind of problems. And similarly, that if you did have a financial shock, you have some ways to save money. That could be giving up your car, or shifting to a smaller home, or renting out part of your house or something like that. There are ways that most households can deal with these shocks. And there's some things we could be doing now to make that easier. What do you think?
Well, there's a lot of really good information there. I'm so curious to get your thoughts on, for example, Translink. So an important service provider, but hit with the economic challenges of losing $75 million a month, so could still operate, save for some of these costly measures that the company is going through. And sorry if the audio is cutting out. It sounds like the connections may be a bit weak. But that sounds like an interesting challenge, because that diversity of our transportation system that you mentioned is very critical, is further impacted by the cost issue. So when we look at how resilient we are, I mean, what's your sense of how resilient are we with these important infrastructure pieces?
Sure. Well, and this is a lot of my research deals with exactly this. I think the starting point is to look at the transportation options and the transportation costs on basically a per capita basis. So it's really easy to focus on one component and develop a big debate, let's say, or you focus your analysis on one component. But I think for what we're talking about, it's important to step back and look at what we're trying to do and what really matters. So let me put this into perspective. There's a huge difference between living in an automobile-dependent area and living in a multimodal area. If you live in an automobile-dependent area, you can't get out of your house, or you can't go to any out-of-home destinations or activities without driving. So, think of somebody who lives a few kilometers from any stores, any commercial centers, and their streets have maybe no sidewalks, or even if they have sidewalks, the roads are wide and busy, and so it's hard to get around by walking and bicycling, and there's little public transit service. Okay, if you're in that situation, when there's a shock to your system, so either as we have now, there's limited, or people are asked to stay home most of the time, and you're discouraged from traveling in shared vehicles. Okay, if you are wealthy and physically able, and you own your own car, you'll do fine. So you can get around. But anybody who is either physically constrained, or doesn't have a driver's license, or doesn't have a car, or has a low income, and maybe they can't afford their car payments, or they can't afford insurance, they are in a highly constrained situation. They are severely disadvantaged if they live in an automobile-dependent area. Conversely, since we live in one of the walkable urban neighborhoods here in Victoria, our life has actually hardly changed. Or I should say, our ability to access our transportation costs and our transportation options have hardly changed, because we happen to live in in one of these older traditional neighborhoods. So, and that has financial implications. People who live in automobile-dependent areas typically spend about 20% of their income on transportation. People who live in very multimodal neighborhoods typically spend 5 to 10% of their household budget. So it's the ability, even if somebody loves driving and they're going to own a car, the ability to say, right now, the next couple of months, I need to save money, so I'm not going to drive. I'm going to park my car and hold the insurance on it. That is a huge benefit, a huge affordability benefit to a lot of people. That's not saying everybody needs to give up driving, but my research points out is that living in an area that is not automobile dependent provides resilience. It provides physical access and economic resilience that is really the part of the basis of this. So now having said that, we can ask, what are the implications of public transportation? You know, how important are buses and subways or SkyTrain or whatever during a pandemic? Some people jump to the conclusion that public transportation is a huge infectious disease risk. And so there have been some people that said, okay, well, this is the end of public transportation, or this is the end of cities. But actually, if you look at the data, that's not true. And in fact, I just today posted a new blog on the Planetism website. So this is the website for professional planners that looks at the actual risks of transportation risks from during a pandemic and how to reduce those risks. And one of the interesting things that the research shows is that there's actually higher rates of COVID-19 infections in automobile-dependent sprawled areas than in compact transit-oriented areas. And this is really surprising, but the results are fairly consistent. And what researchers suggest is that if you live in a compact transit-oriented neighborhood, so you live in, say, around a SkyTrain station, or in one of the old neighborhoods in Vancouver or here in Victoria, when the pandemic kicks in, you simply don't, you significantly reduce your trip making. So you might go from making 10 public transit trips a week, you know, you're commuting 5 days a week on public transit, to making 2 public transit trips a week. And the other 4 days of the week, you're walking to local stores or bicycling to local stores, and you're working at home. So in the transit-oriented areas, there has been a huge reduction in total motor vehicle trips. Where people who live in more automobile-oriented sprawled areas, they're still making almost the same number of vehicle trips as they did before, because they don't live within walking distance of shops and services. And they're probably going to a much wider range of destinations. So if you live in Surrey or Richmond and you're accustomed to driving everywhere, you probably go to quite a few different destinations. When I go shopping, there are only 2 stores that we go to here, because those are the stores within walking distance. Where people that have cars are going to go to probably a half dozen. So and because driving seems safer, motorists are probably taking fewer precautions than people who are using public transportation. So if everybody only had 1 car and drove alone, it may, the contagion might not be so severe, but most motorists are probably carrying a few passengers occasionally. They're picking up kids, they're taking their kids to visit friends, they're picking up they're taking their mother-in-law to medical clinics or whatever. And so there probably are similar risks when somebody carries a passenger in their car as when they use public transportation. That is, there's probably about the same being in a constrained space and a similar number of touch surfaces. It's just that motorists probably make more of those trips, and so our motorists are more likely to be exposed compared with somebody that lives in a walkable neighborhood. So the research is pretty clear. There are many factors that affect our infection risks, our chance of being infected by this pandemic. And using public transit, even though it may be an exposure risk, it's not the primary factor affecting pandemic spread. So anyway, getting back to the economics, I do think that it is very important to provide public transportation. That is a very basic service. So I do support transit agencies developing plans so they can maintain service in the future. I do recognize there's going to be a great reduction in transit ridership, just like there's a great reduction in car traffic now. So we do need to be responsive, but I see no logical justification for significantly reducing public transit over the long term. In fact, for affordability's sake, I think we need to support more affordable travel modes, public transportation, and walking and bicycling. What do you think? Does that answer the question that you raised?
I think so, yeah. And I appreciate the context because that's a really important piece of this, and the affordability aspect too. I've seen people talking about the fact that we had an opioid crisis before this. We had a homelessness crisis before this. This is compounding some of those impacts, including the affordability crisis we were going through. Unfortunately, we're almost out of time. I encourage everyone to go and read your report because there's so much great information in there. But for anyone who hasn't yet looked at it, what do you hope they take away from your report? How should people maybe start thinking differently, or what should they maybe take away from the experience we're going through?
Well, if nothing else, it is that this pandemic or other disasters show that these kind of events are actually a bundle of problems. It is not, the pandemic is not, the problems that result from the pandemic are not just an individual's risk of getting the disease. It is also the risk of their neighbors getting the disease, and particularly disadvantaged groups. It is the economic shock and what that means to their communities, and it's an opportunity to rethink how we want to lead our lives. So, for example, the importance of having a house that's nice enough that if you do have to spend a few weeks locked away in your house, that you have decent natural light and decent fresh air and enough space that everybody in your household can have a little privacy, and that it is what we're discovering, it is very important to have high-speed internet and other electronics. So it's a reminder that there's some good household design decisions and community design decisions that we can make to prepare for the slings and arrows of outrageous fortune, as William Shakespeare said, or you could say the uncertainties of life. So affordability is a big part of it. Having a comfortable house is a big part of it. Having diverse transportation systems is a big part of it. And also building up those community relationships. So a big part of this is really about the value of living in a community and communicating, good communication between your community leaders and the residents, but also between people in the neighborhood. So you're having a good relationship with your neighbors. All of those are important all the time, but they're particularly important if you're preparing for a disaster. So are we ready? Are you ready for the next unpredictable shock to your household or to your community? Are you?
That's a really good question. I can tell you that I've certainly made some buying decisions and decisions around what we spend, what we have in the house as a result of this. Made us rethink too, we hadn't updated our earthquake preparedness kit in a long time, right? So did the shop. We have water. We thought through, what do we do if we don't have heat for however long? Things that it's really a luxury to not have to think about that all the time, even though it should be top of mind. So it's been an interesting process.
A good disaster kit is important. What about some of the other things? The ability to get around without a car, or the ability to deal with a financial crisis. Is that part of your disaster plan?
For me, yes. We've also had on this show actually some financial planners too, that rule of thumb where you're supposed to have 3 to 6 months of your salary saved away. Most people, again, a bit of a luxury to be able to do that. A lot of people may be living paycheck to paycheck and can't. That's certainly something in our household. We're making sure that we have that ready to go. Also, because so many people who thought their jobs were secure and typically maybe would be fairly secure have seen their job close, seen the company that they worked at close as a result of this unforeseen circumstance.
Sure.
Really,
so for many people, it will be difficult. The good news is that we do live in a compassionate and responsive society. And so I think even though right now it seems extremely stressful and uncertain, I think most people are going to be able to weather the current disaster well enough. And actually, I think a lot of people will learn will find many benefits. If nothing else, they'll appreciate the small things in life, like being able to go for a walk or a bike ride and hug their family and friends, and little things in life will be much more appreciated. So I hope that this is going to be, for most people, ultimately a positive learning experience. So like my grandmother said, hope for the best, but prepare for the worst.
Wise words. Todd, thanks so much for coming on the show.
Thank you, Haley.
That's Todd Litman, founder and executive director of the Victoria Transport Policy Institute. And if you're interested in the report we were talking about, vtpi.org, you can go and find it there. Thanks again, Todd.